Hi, I'm Amy Bouton, Public Information Officer for St. Tammany Parish Government. We're here today to give a COVID-19 update, and St. Tammany Parish President Mike Cooper is here to join me. Thank you so much for making time today to be here.
Thank you, Amy.
You're welcome. So we know that here comes another holiday weekend. We're about to celebrate Independence Day, and we're still in phase 2 with an extension. So what is the message that you want to get out to citizens this holiday weekend, particularly about COVID-19 mitigation, mitigation of the spread?
This weekend coming up is a weekend where we have large gatherings and people want to get out and be with their family and friends. Mm-hmm. We are strongly urging that our citizens take all the precautions to social distance, physical distance, keep your hands clean, wear a mask. I strongly urge our citizens to wear a mask when they're out in public, whether you're going into local businesses, to the post office, or any business, restaurants, wear a mask. Our businesses, the employees and those who work at restaurants and businesses are required to wear masks. So we're simply asking that our citizens comply and wear a mask as well. It will help mitigate the spread of the virus and allow us to move forward into reopening at larger capacities. Mm-hmm. It will allow us to have more normalcy when we open schools up. So we're strongly urging our citizens to wear masks.
And you just kind of talked about that today briefly in a statement, and you were talking about the fact that we are open and you support the phase 2 reopening, and you will continue to encourage people to wear a mask unless the situation warrants otherwise. So it's important for every citizen to take the precautions and do the right thing so that the businesses can reopen fully. And I think that's another way to kind of support the businesses is by doing your part to not spread anything in their shops and their little boutiques or restaurants. So I know that you've been in contact with a lot of medical experts. You've been watching the numbers closely. What are the medical experts telling you about the importance of wearing a mask?
Well, they're certainly saying that it's important to wear a mask. It is the number one factor in mitigating the spread of the virus. We do not want to be in a position to where we have to go back or to where we have to stay in phase 2
right.
for a long period of time. So yes, we certainly want to do so. Our business owners and the employees are already wearing their masks, and we strongly urge them to continue to do so. Mm-hmm. In fact, it's a mandate.
Right.
And many of them are actually requiring their patrons to wear masks. So we're simply continuing to remind our citizens and to urge them to wear a mask to help slow the spread or mitigate the spread of the virus. Otherwise, if the numbers do change and we continue to see a slight rise in the number of positive cases and hospitalizations, other steps may have to be taken.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
we want to welcome Dr. Gino Lagarde. She is the medical director for the Louisiana Department of Health Office of Public Health for Region 9.
With regard to the North Shore, we're not seeing as much of an increase in our hospitalizations, but we are seeing an increase in our cases. Most of our cases are still community spread. And I will tell you, in St. Tammany Parish alone, since Sunday, we've had 83 new cases. That's too many. We in St. Tammany Parish, the cases account for maybe 4% of the state cases. And with regard to deaths, the deaths in St. Tammany Parish account for about 5.6% of the deaths overall. So with that said, I am very concerned. Our positivity rate has increased as well.
So we talked earlier in the week about the fact that we are moving around more freely, but that doesn't change the fact that we can still mitigate the spread. And what is your recommendation to the public and the citizens in mitigating the spread and helping us to stay, to keep that spread as minimal as possible, especially with the holiday weekend coming up?
Oh, yes. Okay. So what we do know is that when we were under the stay-at-home order, we were very successful in reducing the number of cases. And what we do know is, and what I would want to really amplify, is some of the prevention measures and risk reduction measures that we know do work. Number one, wearing a mask or face covering when you're outside, especially if you will be within 6 feet of someone. But just that general practice of wearing a mask or face covering outside of your home will help. Physically distancing, minimum of 6 feet from someone else. Yet again, we know you can be social, you can talk and hold a conversation and enjoy some company, but again, respecting that physical distance. Simple measures of hand hygiene, washing your hands frequently with soap and water for at least 20 seconds. If you don't have access to soap and water at that time, hand sanitizer on your hands with at least a 60% ethanol concentration is what we recommend. And disinfecting your frequently touched surfaces. But I think also the biggest message is that, yes, we've had a lift of some of our restrictions with movement, but again, avoiding large crowds is another way to significantly reduce your risk of being exposed to COVID-19. Especially as we approach this 4th of July weekend, we're used to going out in large crowds, having large family gatherings, watching fireworks and in the park with large crowds, but enjoy that view from your television. Don't limit your contact with your immediate family, because yes, other family members outside of your household can spread COVID, and not all people infected with COVID will have symptoms. So that is my biggest message is remember face coverings, wear mask works, social distancing works, hand hygiene works, avoiding large crowds work.
Well, we very much thank you, Dr. Lagarde, for joining us and bringing us up to speed on not only our region, but our state, and also reinforcing those best practices for our citizens.
And I will let you all know that, we are continuing our community testing right now. So far, we've tested about 4,525 North Shore residents to date. And we're working with our community partners, Oxna, LCMC, New Orleans East Hospital, and our federally qualified health centers to be able to continue providing that community testing. Right now, we don't have the schedule for our National Guard mobile testing for next week yet, but as soon as we do, we will let you all know about the test sites that will be available. We're continuing contact tracing, and that's very important. That I want to get that message out for those people who test positive. They will receive a call from our contact tracers, and it is an anonymous, everything is anonymous, but we do have to understand where if you test positive, where you've been, to see where you may have contracted it, and then all those folks who you may have come in contact with. So again, we can make sure that they are also aware. And we're continuing to work with congregate settings like our nursing homes, and we will be working very closely with our schools to ensure that they have a very safe plan for our children to be able to return to school in the fall. And if there's any information that the general public will want to know, we do have our 211 line that is still very active.
Great. Well, thank you so much, Dr. Lagarde. Have a wonderful Independence Day weekend. Thank you for joining us. We'll be right back.
If you decide to wear a medical mask which is pleated and flat like this one, it is important to wear and discard it correctly. Otherwise, instead of protecting you, the mask becomes a source of infection because of the germs that may stay on it. To wear it correctly, you should locate the metal strip at the top of the mask, place over your nose bridge, secure the elastics around your ears or tie the strings behind your head. Make sure it covers your nose, mouth, and chin. While in use, do not touch the front of your mask. To remove the mask, take the elastics from around your ears or untie the strings behind your head. Do not touch the front of the mask as it may be contaminated. Remove the mask and discard in a closed bin. Cleanse your hands with alcohol hand rub or soap and water. Hand hygiene should be done if you accidentally touch the front of your mask while wearing it. If your mask becomes damp or humid, replace it with a new dry mask. Never reuse single-use masks and discard them immediately into closed bins after each use. For more information on mask use and the new coronavirus, check WHO website at who.int.
We are back, and joining us now is Chief Butch Browning. He's our Louisiana State Fire Marshal. Thank you very much, Chief Browning, for joining us today.
Thank you. Thank you.
Can you tell us how enforcement and non-compliance with these requisites is being handled, and how citizens who might feel like they have something they need to report can use those mechanisms?
First off, I want to commend St. Tammany Parish, and specifically the parish president, for their leadership in working with the state, working with the federal guidelines as Governor Edwards adopted them and deployed them in Louisiana. Specifically, we've been working with the parish government here in the Fire Marshal's office with several fire districts from Slidell, Madisonville, Mandeville, Pearl River, Goodby, and Abita Springs, to go out on this quest to educate people on the guidelines. You know, first and foremost, everybody knows the seriousness of this virus. And if you contract this virus, you get sick, you spread the virus, and in these tragic cases, people die. So, you know, certainly this has been an important mission for all of us in the world of public health and public safety to abate. And I think we've done a great job in learning as we go and try and do the right thing. You know, there was no code book, there was no standard on the mitigation measures on how you open up a business. And that's why when it came time to, I guess, enter into phase one, the Fire Marshal's office was the right agency because of our relationship with business people. You know, we stand for safety every day, but the most important thing we stand for after that is economic development. So we saw the need to be able to put our people in motion, both on a state level and on a local level, to help businesses understand what they needed to do to be safe and open up. And I think that's been tremendous. I mean, our opensafely.la.gov site, where people could sign up and where the public could go to get common sense guidance on how to operate a business, both from a patron standpoint and an owner-operator standpoint. It's been great. And it's created a tremendous amount of collaboration. I mean, we have been in businesses, we've talked to people, we've helped them get table arrangements appropriate, we've helped them understand their capacity and understand, of course, what the medical professionals are giving us on how to mitigate, from the masks, from the hand sanitizers, from the sanitizing of the buildings and all these things. So, you know, as is no secret, our phase 2 does not look good right now. Our numbers are bad, and the governor's doing everything he can to hold us where we are. We don't want to step back, but if we don't stop the spread of this virus, you know, we may be in a situation we don't want to be in. So we're really amping up right now. Though we've been a consultant, we've been educating, we've been talking to people on the phone, and we have received complaints and concerns. Many of those we remedy by telephone in businesses. The last week and a half, we've been very proactive. We've actually gone out and I guess preempted what we call courtesy visits, where we go to random businesses and we go in and we make sure, number one, that business has the guidance on how to operate safely, and we work with them if they have questions, if they have misunderstandings. And in many cases, what we found is business owners have taken the standards and they've created a best practice that might even be better than the minimum standard. So, you know, I ring a lot of success in that. But the reality is we're still having exposures, we're still having positive tests. So we've got to do a better job. Maybe perhaps people are being a little complacent. Maybe they were more on their game, you know, some 4 weeks ago as it related to cleaning their business, to making that strict count to make sure they don't go over capacity, to make sure that social distancing occurs if people are seated in your restaurant. You know, we got to get past that and remind people today is very important, because what we do today will be judged and graded by positives or negative tests 2 weeks from now. So, you know, we've really amped up these visits. Certainly, we're very concerned about this weekend, this holiday weekend, just as you compare it to Memorial Day, where it's believed a lot of our positives occurred. We're going to go out. We're going to have most of our uniformed deputies will work all weekend, but we're going to start going into businesses that gather. And that would primarily be restaurants, bars, and event centers. We're going to go into those places while they're operating at full capacity when they're the busiest. We've tried not to do that before now, but we're going to go in and we're going to work with them and make observations and make sure they're in compliance. And we just got to take it this next level. And again, our spirit is about cooperation. Our spirit is about helping businesses be successful in a safe manner. And if we got people who can't work in that environment, then, you know, we're going to have to look at it from a different lens. And, you know, and of course you've heard, I mean, there's a risk of losing your liquor license. There's a risk of losing your food service license. I mean, there's a risk of being accused of defying the proclamation. We don't want to have to resort to those things. I believe, and I'm a believer, that if you talk to people, if you bring people to the table and you create understanding, you get compliance. But we got to make sure we have full compliance now. We can't afford to live on 85 or 90% compliance. We need 100% compliance. So we're going to do that. So I'll tell you from an enforcement standpoint, compliance is really easy. I believe that business owners want to do the right thing. They don't want to do anything that's going to jeopardize their employees or their patrons or the visitors to the envelope of their building. But it starts with personal responsibility. You know, you should not go into a business, and if you feel like the employees are not wearing masks properly, if you potentially feel like the building's not cleaned properly, or you think that the building's overcrowded, you need to speak up and talk to the management. It's no different than if I go get a meal and I'm not satisfied with my meal, I'm going to let the management know the meal was not prepared to my liking. That is the first step. And of course, the second step would be walk out the business. Because, you know, if you contract the virus, you got the virus. You know, you can't give it back. So your personal safety is the utmost importance. And then finally, if you feel like there's a business that's not operating appropriately, you can notify the fire marshal's office. You can notify the local jurisdictions that are doing enforcement. And we'll go in a very courteous manner and clear up any misunderstanding. And that's just the spirit of cooperation. I think we've done a whole lot of great things by approaching this, by, I guess, extending the olive branch, if you will. And being nice about this, and people want to comply. comply. I mean, that's kind of what I found. We have not issued any citations. We have not closed any businesses down across the state, because in the end, if we can sit and talk to people, they know this is real. I tell a story all the time. I have 6 phone numbers in my cell phone who are friends of mine who are not living today, that has passed because of COVID over the last 4 months. So it's real to me. I mean, I know what's happened.
You're encouraging the public to first and foremost have that conversation with the management and recognize that, you know, just like you do, they want to have that spirit of cooperation as well. And it's very crucial to get to the next phase to cooperate and to comply.
And that is correct. And look, these business operators and owners, they have employees, and they manage their employees. They provide leadership to their employees, and it requires them to be on their game every day to make sure their employees are following the rules. And many of them want to know if they're not. So it really works if people can have a conversation.
And if a business owner or
a consumer has any questions about the guidelines, or, you know, they've just decided to open up right here in the middle of phase 2, they can, what kind of resources will they find on Open Safely?
Yeah, so opensafely.la.gov is a tremendous resource. I mean, I'll tell you, we're probably really the only state that's really drilled down and given guidance, common sense guidance, even common sense guidance that businesses can figure their own capacity without the fire marshal or the government having to come out and do it for you. I mean, we really tried to create something to where it's a one-stop shop. You can have all the resources in your toolbox and open your business. But if you go to opensafely.la.gov, you can choose to sign up. And when you sign up, you answer about 4 or 5 questions, including the name of your business, where it's located, what kind of business it is. And when you sign up, you immediately are transmitted by email the current guidance on your business type. The beauty of being signed up is we can now push information to you as conditions change. For example, the folks who were signed up prior to phase 1 or in phase 1, as phase 1 went to phase 2, they were immediately transmitted to phase 2 documents as it was under development and upon final approval of the health officials. So it's really good situational awareness. We push information out on a regular basis to keep business people updated. If you don't want to sign up, you don't have to. There's a link underneath the sign up button where you can download the current adopted guidance on each business. So for example, if maybe you have a restaurant and you haven't opened yet, you can actually go and click restaurant phase 2 and see what's required. Same thing with a place of worship, same thing with a gym or even a movie theater for that matter.
Okay, well, I don't think I have any other questions for you, but is there anything else you want to add? And of course, we know your time is valuable, but we want to give you the opportunity to add anything you'd like to our listening audience.
No, I'm just going to double down on what you'll hear through this week. When you've already heard, you know, it is very crucial that we take these mitigation measures very, very seriously right now. I mean, it's a personal responsibility. You know, some communities, some cities are mandating people wear masks. The state has not done that. But I'll tell you, as a personal responsibility, no matter what city you're in the state of Louisiana or a parish you're in, you know, if you go in public, you should wear a mask and you should have hand sanitizer in your pocket or in your close proximity, so you cannot, number one, spread whatever virus you have, but also not contract a virus that may be in your area. You know, we've really got to do these things and make sure that we're safe. And it's hard. Look, we're a state that, you know, we hug, we touch, we socialize. I mean, we didn't know what social distance meant till this happened, because we had no distance. We're a very close community, and it's hard to step away from that. But we've got to remain we got to remain really cautious about everything until, you know, they can get the virus created that we can all take and do away with this virus. So anyway, I would just encourage people to be vigilant, and you know, and I appreciate the Louisiana people. I have the utmost respect for what our business people are doing, because they are doing a very valiant job. And I also have the utmost respect for our parish, our city leaders, because they're fighting a fight that they weren't really elected to do. Nobody thought a pandemic would be our emergency. I mean, we know what hurricanes do, we know what floods do, we know what tornadoes do, but we never understood as public service folks our role in something like this. And they're doing a great job, and we're standing up for people's safety, and that's what we're supposed to do.
Well, we thank you very much for joining us, Chief Browning, our Louisiana State Fire Marshal. Have a wonderful and safe, happy Independence Day weekend.
Thank you.
We'll be right back.
The new coronavirus can spread through respiratory droplets, which are liquids that may come out when we cough or sneeze. For this reason, it's very important to avoid close contact with anyone who has fever and cough or other respiratory symptoms. In practical terms, we recommend keeping at least 1 meter distance from a sick person. Also, you should avoid shaking hands, hugging, or kissing people with these symptoms. If you need to take care of a person who has fever, cough, and difficult breathing, do not forget to wear a mask and in particular to practice hand hygiene. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int.
We are now joined by Dr. Charles Preston. He is the St. Tammany Parish Coroner, and we appreciate you joining us today, Dr. Preston.
Thank you. It's my pleasure to be here and try and get this very important message out to the people of St. Tammany Parish.
That's right. So we are continuing on in phase 2, and there's a little more additional movement throughout our community. And I wanted to ask you if you can tell us from your perspective what you think people should continue to do in order for us to slow the spread of COVID-19 as we continue through phase 2 and hope to kind of move into phase 3 sooner than later. So from your perspective, what's the best advice you can give our citizens?
Well, I think the best advice has really not changed. It is the simple things of covering your cough, social distancing, washing your hands, and wearing a mask. And wearing a mask really is a critical function to try to stop the spread of the virus. We know that the viral particle is spread through talking and coughing and shouting, and the louder you're talking, the further that particle is going. So it's very, very important to protect yourself and to protect your neighbors by wearing a mask. A mask is essentially the only vaccine that we have right now. And just like for an injectable vaccine to work, we have to have herd immunity and everybody has to use it. It is the same thing for the mask. We need everybody in the population to wear their mask to slow the spread, or it is going to grow like wildfire and the consequences will be catastrophic.
And can you clarify for people, when you wear a mask, you are protecting, tell people who you're protecting when you wear the mask, because there's a lot of misinformation out there, and we want to put out the right and accurate information about what you're doing when you wear a mask and who you're protecting when you wear a mask.
Well, of course, some of that depends on what kind of mask you're wearing, but I think universally you can say that you are protecting yourself and you are protecting everybody around you. The conventional wisdom in teaching has been that if you wear a simple cloth mask or a paper surgical mask, that is keeping your droplets from going forward. And there was just a study released a week or so ago that looked at different kinds of masks and how far the respiratory droplet went. And with a 2-ply cloth mask, the droplet went a few inches in front of the person. Bandana, they went almost 8 feet in front of the person. So it certainly is protecting everybody around you, but it also gives some element of protection to the person who is wearing the mask.
And in addition, so if you combine social or physical distancing with wearing a mask and then the best practices of hand washing, you have a pretty good chance of, even though you're moving around and interacting with other people, your chances are much greater in preventing the spread of the virus.
Absolutely. And you know, we all are hoping for a vaccine, and there are a lot of really smart people working on the development of that vaccine. But, you know, even under the best case scenario, the vaccine has to be tested for safety, then it has to be tested for effectiveness, and then it has to be deployed to an entire population in order to gain that herd immunity. Wearing a mask gives us protection right now. And I think that that is absolutely critical. Those 4 simple steps: wash your hands, cover your cough, social distance, and wear a mask.
Well, we certainly thank you for taking the time out of your day to join us. Is there anything else you want to add to those words of wisdom?
Well, I think we all felt the pain of phase 1 the first time that it went through, and I know that President Cooper is monitoring these numbers very, very closely. We always count on our very intelligent electorate to do the right thing for the community, and this really is an opportunity that it's not a political issue, that it's not that you have a constitutional right to be able to smile at people. This is a public health issue. And if we don't follow these guidelines, then the number of cases are going to soar, and we're not going to have any choice but to move backwards. And as I said, I think that would be catastrophic if we had to move backwards.
Thank you, Dr. Preston. I concur with you, and thank you for reiterating the importance of taking all the precautions for mitigating the spread of the coronavirus and keeping our community healthy. I can't agree with you more that the number one way of doing so is to wear a mask, and I strongly urge our citizens to do so.
Thank you very much,
agree.
Dr. Preston, for joining us, and have a great Independence Day weekend.
Great. Thank you so much.
Well, is there anything else you want to add before we send off into the holiday weekend?
I would like to thank Dr. Lagarde for being on the air with us earlier. Dr. Lagarde is with the State Office of Public Health, and she's gave us an update on the health condition of our parish, and we want to thank her for joining us. I want to thank State Fire Marshal Butch Browning for joining us earlier. He gave us an update on how to be compliant with the capacity requirements and the wearing of the mask by employees. So thank Chief Browning for being with us. And I want to thank Dr. Preston, our coroner for St. Tammany Parish, who has given us an update on how we can protect ourselves and protect each other during this critical time in reducing the spread of the coronavirus.
Great. Well, thank you very much for your time. And that is our update. Thank you for joining us. All of this information and more is available at www.stpgov.org/COVID-19.